Hydromorphone, which in and of itself, from a chemical standpoint, is a pretty great drug, right? But there's countless deaths from drug name confusion. You know, they get hydromorphone 10 confused with morphine 10. And we'll talk about that case in a minute. And, you know, we talked about that the fact that the 1 milligram has been in shortage has made this safety issue even worse. So should we be drawing up hydromorphone in 1 milligram and then putting it in the cabinets? Because now that we've trained people to use the lowest dose that's appropriate for that patient population, and then we throw in 2 or 4 times as much, if you send it, they will give it. So think about giving 28 milligrams of morphine. So everybody can read this. This is a real prescription. This was a Sentinel event. I can talk about this event and show you pictures because this was published on the internet. So to me it looks like HARP, you know, the Housing Something Recovery Program. This says Morph 10 milligrams IM. Now, what's Morph? It was, you know, you talk about culture and safety culture. This hospital had it was inherent in their, it was an organizational norm to abbreviate names. I work in Emerge. She works in Surge. We have Fent 100 and Diase 10. I'm not kidding you. The entire hospital, it was on their forms, it was in their vernacular. So those are the things you don't learn unless you go and talk to the people. And honestly, this is one of the things that contributed. So laziness on the part of the prescriber in a way, but you know, they're used to it, but also they just didn't want to write INE. You know, they just wrote Morph 10. Okay, so there's an order for Morph 10, and this is a brand new emergency department. When we interviewed the staff, they said the old emergency department med room was way better. It was in the corner. It was a little crowded in there, but it was isolated. This one is med room in the round. This was a really bad design concept because the nurses are doing critical tasks right there, preparing meds. The narcotic cabinet is up over the fridge, but to the right is a bunch of their other medications. So this is one of the highest hazard things we do in healthcare, and the families, okay, excuse me, they're getting constantly interrupted. So the nurses love the new emergency department and hate the med room, that med part of it, you know. So here's a part-time nurse in the selection process, Morph 10, you know, think about it, goes to grab some morphine out of the cupboard, out of the side of her eye. The patient that passed away was in the right room. In the left room was an elderly patient who shouldn't even have been there. One of those can't find a bed, you know, because it's jammed up. We got gridlock upstairs. He's going over the bed rail. Oh my gosh. Grabs something, sticks it in her pocket, runs to keep the patient from getting a subdural and doing a half gainer over the bed rail. Comes back, looks at the vial. It says Morph 10. And gives it. Well, here's what and actually, this is not a very cluttered cabinet. This is a poster child for organization in narcotic cabinets. The one she took was the one on the right, the gray box on the right. The yellow or the red one and the left gray one are both morphine. The one on the right is hydromorphone. This was a leftover from a hospice patient that had been there, and they had a real high-powered stuff. And the patient had been there, and so they delivered it down there and never brought it back. So it didn't even really belong there. So they don't look alike at all. The hydromorphone is a vial. But she remembers seeing Morph 10. The other thing that happened is they took off the drug identification. If you see the package, there used to be like a strip over the top of it that helped identify what was in that box. But because they had to do narcotic count continuously, they ripped the strip off so they could easily see how many vials were in there. That's like a uni vial. It's a Canadian thing. Another thing that Canada has a issue with is they have twice as much information on their labels, because their labels are required to be bilingual. So they have the smaller size, because it's in French and it's in English. So now they have compressed label size. So what did we recommend on the RCA? So I was on the team that went there, and this had a press release. It was really kind of interesting. But our recommendation, people said, well, you can't recommend that. That'll never happen. And we said, as an RCA team, we have to recommend it. That's the right thing to do. It's up to people up the food chain if what they do with it. But as an RCA team, we should put in there what needs to happen. And we recommended to Health Canada to follow the World Health Organization's policy on using drug stem names, because they had a product called Hydromorphone, and they even abbreviate their drug names. Official drug names are truncated. So we recommended that, and we, more importantly, Health Canada recommended to the USAN, the United States Adopted Name Group, that's a multidisciplinary group that says what drugs should be called, that this drug needs to change the name. And Mike Cohen from ISMP and David Yu from ISMP Canada marched to that committee, and they got turned down. I cannot believe it. I thought it would have finally gone through. How many people need to die before the drug name gets changed?